An estimated 20 million Americans take statins to reduce cholesterol, but a major new study suggests that millions more could benefit from these medications as well, including people with normal cholesterol. NJN News health and medical correspondent Sarah Lee Kessler reports.
This cholesterol study, published in last week's New England Journal of Medicine, is being hailed as a watershed event in disease prevention. It involves Crestor, one in a class of statin drugs that lower cholesterol.
Would you be interested in taking a medicine that could have the chance of you having a stroke or a heart attack? Even though you have the normal cholesterol.
Certainly consider.
Dr. Richard Goldwhite, chief of cardiology at Englewood Hospital, was not involved in the study. It was led by researchers at Brigham and Women's Hospital in Boston. But Dr. Goldwhite says the results were impressive.
The major finding was a major reduction in cardiac and cardiovascular events. In fact, it was so noticeable that they stopped the study early at 1.9 years.
Deep breath.
The study, which was international, involved 18,000 people who had low LDL or bad cholesterol and high levels of C-reactive protein, a marker for inflammation, often of the heart arteries.
This is an amazing way to sort of look into the arteries and the vasculature with just a blood test. And when they did the analysis with respect to weight and blood pressure and smoking, the benefit seemed to translate to those even who didn't have those kind of standard risk factors.
The study, like most involving prescription drugs, was paid for by a pharmaceutical company. In this case, AstraZeneca, the company that makes Crestor. But the researchers who led the study said the sponsorship did not affect their findings.
The money trail is of concern, but this was a very large study. It would be kind of mind-boggling to figure out how the results could be manipulated to such an extent that it would produce these kinds of findings.
What's unknown, because it wasn't studied, is whether all statin drugs could produce these results or whether it's just a Crestor effect. Sarah Lee Kessler, NJN News, Englewood.